Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is the situation report for COVID-19 dated 19th of April. So current picture, R remains fairly stable, somewhere between 0.8 and 1. The overall 7-day rate is now just less than 50 per 100,000 and falling pretty quickly. Actually, a week or two ago, it was more than 100 per 100,000. The over 60s rate continues to fall, and importantly, the Pillar 1 positive test rate is low and fairly constant at about 1.5%. So Pillar 1 of people being hospitalised or people being diagnosed with COVID in hospital is very, very low and actually constant. Hospital activity with COVID is again very low, currently less than 2%. A couple of months ago it was 25%. So you can see that we're in a very different position now. All recent changes are absolutely in line with the expectations that we thought they would be. So that's mobility, the R as it changes, cases and contacts per cases. This is playing out as we'd expected. There are no flashing red lights on my risk radar at the moment. That may change, but currently there aren't any. It's clear we're a day or two into step 2, and that will put more pressure on R. There's no two ways about that. And moving from step 1 to step 2, the modelling assumes that people will do what the guidance says they can do rather than what they shouldn't be doing. Testable assumption. The modelling says it will be okay, but modelling is modelling, and it's sobering to look at what's happening in other parts of Europe. So no flashing red lights on my risk radar, with some buts and some caveats. People ask me a lot about my assessment against the 4 government steps. Yorkshire's a little bit of an outlier, mainly on account of what was happening with regard to the timing and geography of tier 1, 2, 3 in late autumn in Yorkshire compared to the rest of the country. We didn't have big prevalence of B117 or the Kent variant at the time the rest of the country did. We're now seeing it. So on the 4 tests, vaccine deployment continues successfully. Yes, absolutely. No real concerns there. The evidence shows that vaccines are reducing hospitalisations and deaths. Again, no doubts there. Infection rates aren't risking a surge in hospitalisation. Again, no doubts there. All of that is looking fairly good at the moment. The last one is the concerning one. The assessment of risk isn't fundamentally changed by variants of concern. Currently, there are no concerns. That may change, but that's the thing that we need to worry about. Hence, if you are travelling overseas at some point in the future, the potential for bringing back into the UK variants of concern is an issue. So that's the key risk that we worry most about. But all up, I'm happy that the 4 tests are definitively met. Take-up of the COVID vaccine has been really, really strong. So 5 out of 6 people in the first 9 priority groups have chosen to take up the offer. That's 83%. That's astounding. That offer remains on the table. So if you're in one of those priority groups, i.e. all people over the age of 50 or frontline NHS or social care worker, that offer is still there. And if you've missed out for whatever reason, I'd really encourage you to take up the offer. Second doses are equally important. We're putting a lot of energy into second doses at the moment. Don't delay. If you're invited for a second dose, please take it. You'll need both doses to get the highest levels of protection. Patients who receive their vaccine at a local vaccination centre in Sheffield will be contacted by their GP to arrange the second dose when it's their turn. That will typically be at 11 to 12 weeks. Please don't contact your GP practice about second doses before that time. The GP will contact you. That might be at short notice. More than 20 sites are now using the newest vaccine that's available to us, the Moderna vaccine. That does include Sheffield Arena. The NHS continues to expand the vaccination programme, and the new vaccine gives us another tool to do that. All of the vaccines, including the Moderna vaccine, are all about equally effective, all about equally safe, and they're all approved by the Medicines and Healthcare Regulatory Authority. For those aged 18 to 29 who are eligible for a jab, the Moderna vaccine provides an alternative to the AstraZeneca vaccine in line with the updated MHRA guidance of last week, and that's what we're recommending to younger adults have. So, as you'll know, a third of us have coronavirus without symptoms. So, so 1 in 3 people who have the virus could be spreading it without knowing it. To prevent this happening, and certainly to reduce the risk, rapid lateral flow device testing is now widely available across England for people to do twice a week. The LFD tests identify positive cases that otherwise might not have been found. And if you know you have the virus, you can self-isolate and obviously avoid giving it to other people. The tests are easy to get hold of. There are several ways in which you can do that. You can get them from a local collection point, including some test sites in Sheffield, some pharmacies in Sheffield, or you can order them online to be delivered to home. And full details of how to get those tests are available on our website, sheffield.gov.uk/COVID tests. The tests are quick and simple. You get results within 30 minutes. If you'd like, it's possible to have a supervised lateral flow device test done first to check that you feel confident about doing it. And you can book an appointment at the asymptomatic testing site at the English Institute of Sport. And again, details of how to do that are on our website. If you test positive using a lateral flow device test, you must book another type of test, a PCR test. Simply test by online or by calling 111. And it's important to say that a negative test doesn't 100% rule out that you don't have the illness, thus you still need to follow the rules that are in place. And it's important to be really, really clear about that one. Don't forget, if you have to self-isolate and will lose income as a result, or if you're the parent or guardian of a child who has to self-isolate, you will be eligible for a £500 payment. So to apply for that, go to the COVID section of our website and select support available for people. I'd encourage people to start using these tests regularly, and we can use them to keep each other safe and to keep the level of the virus down to the minimum.